somebody is coming. Dr. Pawan ji, namaskar. नमस्कार डॉक्टर पवन जी.
दिनेश बोल लेने दो, सर को सो जाना है. कुणाल को फोन करके बोल, बाद में बोले.
Yes, sir.
Sir,
okay. You can continue, sir.
Sir, Rao sir can continue.
Okay.
International webinar series. And today's topic of all the speakers are quite different, multi-dimensional. Mode of action of Char Sutra on anorectal tissue. Dr. S.D. Rao from Tirupati. Welcome, sir.
Thank you, sir.
Next,
I am also privileged to join your group for this webinar. Thank you.
Then chronological, overview of chronological anesthesia from Sushrut to modern in proctology. Our Dr. Kunal Kamte, Director, Dr. Kamte's Clinic from Pune. Raktamokshan, Dr. Pankaj Tathed, HOD Department of Panchakarma in Sion College, Mumbai. Our Dinesh, Dr. Dinesh Pangavne, Assistant Professor from Kopargaon, Ilyanagar, and our beloved dear brother, Sri Dr. Mahesh Sanghavi. आपके दर्शन हो गए तो अमरनाथ जी के दर्शन हो गए. यो समझ लीजिए महेश भाई, आपके दर्शन हो गए. रियली सैल्यूट.
पवन जी पहले भास्कर राव जी बोले, आपने सॉरी राव सर बोलेंगे, बाद में कुणाल बोलेगा.
सैल्यूट टू योर प्लान.
आपकी प्रार्थना से, आपकी सम्मति से.
थैंक यू. So, Dr. Dinesh, now stage to you.
Yes, sir. No, I request Rao sir to start his presentation, sir.
Sir, are you getting my...
Your voice and
yes.
Your voice and picture is very clear, loud and clear. Go with the slide.
Okay, nice. Thank you. So I'm very much thankful to all of you, because you have allowed me again to speak on this specific matter and specific actually subject. This we have actually carried out this research way back in 2002 to 2010, and that was actually my work for the PhD also. So let us directly go into the subject. Vina Venkatesham Nanada Sada Venkatesham Smarami. This is our Lord Balaji and his consort Padmavati. Lord Dhanvantari, my father Naman to Dhanvantari. And this is a picture we prepared and we got it painted by a local artist, that is of SUSHRUTA, who is actually approaching to do the surgery. And of course, my respectful pranams to Professor Deshpande, who actually was behind this to invent the Kshara Sutra. So today's topic, I will be giving some introduction. Kshara Sutra is now well-established technique. Its management and its availability is well known throughout India, and everywhere people are now using it, particularly the Ayurvedic anorectal surgeons, and they are well documented now, because many papers are coming and many books are also printed, published. So we have enough knowledge and enough techniques. There are so many techniques are also introduced. New techniques are introduced. Partial fistulectomy or IFTAC and other techniques are also introduced. And this is going on. And in our center here in Tirupati, we also do the extensive surgeries over these anorectal disorders with Kshara Sutra. But there is a lacuna, what I feel is, because how this Kshara Sutra works, how it affects the local tissue, that we have to know. And for that, in this direction also, some workers, they came forward and did some histological work, taking the biopsies and taking the understanding the wound healing process. And few other worked as they thought that this is actually antibacterial, it exerts the antibacterial effect, and they started working for the antibacterial effect of the Ksharsutra. And some of the people, they were believing that the Ksharsutra will work because of its pH, and they have studied the various pH values and various steps of ksharas. But there is a like, that the biochemical level of changes that occur in the tissues, in the local tissues, in the anorectal tissues, that was not studied so far. Even after my work from here, I saw very few people were actually going in this direction. So what is the need of the study? Because people think that there are four ways of Ksharasutra's effect. Some people advocate that it is only a mechanical action, because you tie it very firmly and it exerts the pressure and it causes some cauterization effect, and due to that there will be cut through the track. Some people advocate that this is a chemical cauterization, but the exact what is chemical cauterization, that is not actually revealed and not actually explained. And few people go with that it's only antibacterial activity, because you use all the ingredients in Sharasutra, they are well-known antibiotics, and that will cause the track very much sterile, and due to that there will be healing. And one more new suggestion, I should say, that it delivers the important ingredient or important active principle into the tissue, and that may be the reason the Sarasutra works firmly. Um, but actually Ksharasutra, what happens, we practically we see when it is applied, there will be local irritation, and due to that there will be inflammation, and sometime afterwards there will be fine linear type of necrosis will be there, and after that the tissue starts shading off from there, the bad granulation tissue or the fibrous tissue, that will be shed off, and then it starts the fibroblastic proliferation, and which will cause the complete healing. So this is the sequel of events that will take place after the use of the Ksharasutra. So let us see one after the other. The first school of thought is that it's only mechanical action, but we see that if a plain thread is applied and it is also pressurized and tightly tied around the Sharasutra track, it will not, fistulous track, it will not give the same result, and seldom it cuts through, and there will be a lot of stuffing also. And so we can easily say that only the mechanical action of the tight fixing of the Ksharasutra is not the way how the Ksharasutra works. And then the chemical cauterization, it's a specific word, chemical cauterization. Cauterization caused by the chemical. Okay, we understand that this is a chemical cauterization may be there, but what exactly happens due to that chemical cauterization, that the deeper studies are required. And here we have done some effort to show that the action of this Sharasutra and its Shara on the local tissue. So the chemical cauterization is also you have to explain in detail. So that is the second school of thought. And then people advocate that it is only antibacterial activity because the Haridra is there, Kshara is there, and Snuhi is there, and other lattices are there, which are known antibacterial agents, and due to that it will become sterile, and due to that it will heal. But this also it is also a challenge, and we have to see whether this also works or not. There may be some antibacterial activity with every Sharasutra, but it's not the whole thing that is causing the complete healing of the tract. And what is local drug delivery? This is a novel technique. Nowadays, this is being used in other these things also, like in cancers and in malignancies. The local release of certain isotopic medicine, the radioactive medicines. So, like that, the local delivery system now it is taking up. But here I can say the Kshara Sutra with the method
Nagesh ji,
you
how
are
are you?
del,
Huh?
sir,
How are you,
sir,
Karao?
am I audible?
You are audible. You have a
Uh,
PPT or you are just going to go through as an walkable?
yeah, I am
आपके
going
पास
through the
PPT होगी?
PPT. Yeah, yeah,
Sir,
Okay.
your
PPT.
PPT is
So
not visible, sir.
Not visible.
Not,
Oh,
sir.
yeah.
Not a single PPT.
So I have disturbed you. Just to
okay,
first
okay.
go through फटाफट PPT. First make a screen of the PPT.
No, 1 minute, sir. I am sharing actually.
नहीं
Not,
नहीं
sir.
नहीं है.
You are not saved.
Okay.
Not share,
Sorry to
sir.
interrupt you, boss. मैं माफी चाहता हूँ आपको
No,
डिस्टर्ब
no,
किया.
ठीक है, sir. I will make it. I will share now. I thought
Yeah.
I
So
am.
Kunal, are you there?
Is it now visible?
नो. नीचे
No,
शेयर
sir.
में जाइए और फिर पीपीटी सिलेक्ट कीजिए. बॉटम ऑफ दिस दी आपके लैपटॉप पे नीचे शेयर होगा, देखो. पवन,
Yes, sir.
दिनेश या पवन, कोई
Oh,
भी सर को
I am
हेल्प करो.
sorry. Pawan, will you give me some hints how
Pawan, sir,
to?
make
I'm
make
I'm
him a
actually
host first.
uh, I was sharing here. I find that share this thing.
इन द बॉटम
Hello,
पे
Your
आप है ना.
Pawan, sir.
browser is share.
You can share.
Sorry, sir.
Not
I'm
sweat
stuck
about
up
showing.
somewhere here. Okay. It is saying your browser is preventing access to share. What is that? Oh,
I have
no,
made you
no.
Sir, make
co-host
him
now.
admin, sir.
Sir?
Yes, yes. Now you can, sir.
Okay. Still it is preventing, sir. Oh, sorry.
No problem, no problem. Take your own time.
Shall I go back and come back again? I will
You
leave the
don't
meeting
have
and
to.
again.
You Pawan,
Pawan, are you there?
Sir, they have made you co-host. You
Mm-hmm.
can share now, sir. Please go on screen share and then share, sir.
Okay.
They have made co-host to you, sir. You can now
Okay.
able to screen share, sir.
No, I am just share the screen blocked. Why it is blocked?
okay. So one thing, can we do one thing, sir?
Sir,
सर,
please, sir.
आप
Sir.
जो है ना आउट हो जाइए, दूसरा स्पीकर करे, तब तक आप टेक्नोलॉजिकली साउंड हो जाइए. Someone will help you on the telephone. Kunal, you can start your speech.
Yes, sir. दिनेश सर,
Yes, sir.
हर्षल म्हणून ग्रुपमध्ये आहे, तर त्याला एक को होस्ट
Uh,
माझे पीपीटी
okay.
शेअर करतोय.
2-3 करेले और होते हैं ना.
हर्षल फुल स्क्रीन.
Hello, Pawan, sir. Hello, Pawan, sir. Actually,
जी आपकी
co-host
स्क्रीन
can't
विजिबल
Sir, Pawan sir, Harshal Phanse is there. Make him host.
आ गया ना, स्क्रीन
Yes,
के ऊपर आ
started.
गई ना,
Screen
स्क्रीन
आ
के
गई.
ऊपर आ गया। अब कुणाल
Sir,
एक अप करके दिखाता है कि नहीं?
नहीं हो सर, हर्षल फंसे करके उनको होस्ट बनाना पड़ेगा।
बनाया ना सर, अभी बनाया था। हर्षल पीपीटी ऑन कर।
आ गया स्क्रीन पे, यू कैन
Okay,
स्टार्ट
okay.
नाउ।
Ali PPT. Should I start, sir?
यस यस।
So thank you, sir, and very regret for Dr. Rao, sir. But Dr. Rao, sir, you can join after my PPT. Yes, first of all, I'm very thankful to IRES, Dr. Sanghvi, sir, Dr. PK Sharma, sir, Ayush Samruddhi, and of course our Dr. Dinesh, sir. We know Sushrut as father of surgeon or first surgeon in the world, and we are celebrating his Jayanti. It's a very good thought of all the team that in such a way that we are memorizing, we are updating knowledge, we are sharing our knowledge with senior most people. So it's a very interesting topic, that is a chronological anesthesia from Sushrut to modern in proctology. Next. So basically, what is anesthesia? Anesthesia, one second. Yes. Anesthesia is the state of being unable to feel anything, typically induced by drug or other substances to allow for pain-free medical procedures. It involves a loss of sensation, which can be localized to a specific area that also we called as a local anesthesia, or involves the entire body, that is general anesthesia. In our Sushruta Samhita also, in Sushruta Uttarasthana 46 by 6, uh, about the anesthesia, that is Saujna Harana, has been mentioned. Next. There are mainly two types of anesthesia are considered as per the modern. Those are regional anesthesia and general anesthesia. Regional anesthesia is considered as a three subtypes, that is a local anesthesia, spinal anesthesia, and epidural anesthesia. And general anesthesia is TIVA, that is total intravenous anesthesia. Next. Then, as we are dealing with the proctology and we are talking about the proctology, there is the importance of anesthesia for the in the proctology. Very important. Without anesthesia, we cannot do anything in surgery, especially in surgery. Anesthesia is a crucial in surgery because it consists painless procedure, allows complex operations, and ensure patient safety and comfort. So anesthesia plays a very important role. Next. In Sushrut Samhita, written by the Acharya Sushruta, he has described over 300 surgical procedures. And during those days, the different kind of anesthesia were used. As we have seen in our text, that is alcohol, that is surapan or madhyapan, cannabis, and opium. These three drugs, these three mode of anesthetic drug or anesthesia were used during those days. Next. In the medieval period, that is 500 C or 1500 C. What is mean by that? The medieval period is also known as the Middle Ages, reference to the period in European history between the fall of Western Roman Empire in the 5th century In other part of the world, such as India, the medieval period is considered a longer time period. It lasts from 8th to 18th century. During these periods in our India, the surgical practices were declined. There are the lot of reasons for that, as you know, ki Mughal Samrajya, then Portuguese, Dutch, then British. There might be, data is not be available, or lot of reasons are there. And during those days, only two drugs were using as an anesthesia. And for the sedation, that was the opium and dhatura. Globally, if we see the Islamic medicine influenced by Indian and Greek test, because they were also using the opium, cannabis, dhatura in a large quantity. Next. Then it is a very good period of the 18th century. The Renaissance was a period in European history, and roughly from the 14th to 17th century, that marked as a rebirth of classical art, literature, science, and philosophy. As we know, Europeans during those days, they research, document more, and advance especially in anatomy and surgery. During those days, ether and nitrous oxide were discovered, especially after the 17th century. Ether was first used in the surgery in March 30th, 1842, by Dr. Crawford Long, who removed a tumor from the patient's neck while the patient was under the influence of ether anesthesia. However, he was not published it, and the first publication and demonstration of the ether was done by Dr. William in 1846 in Massachusetts General Hospital. Later on, in 1790s, Dr. Davy experimented the psychotropic properties of nitrous oxide into in different dental diseases. But still, it was the period there was no any other standard anesthesia in proctology, but other surgeries were performed. Next. In the 19th century, it was a very breakthrough that we found, in especially in proctology, different kind of the anesthesia. In 1946, first public demonstration of ether anesthesia was held in USA for the hemorrhoidal surgery. In 1847, James Young Simpson inspired a report of chloroforms as a good anesthetic for pain relief during childbirth also. In 1814-17, Dr. Harris, he used, especially in US, he used for the tooth extraction. But one bad incident happened in 1848. The first death occurred from the chloroform in US, and it shows a dangerous sign, and a lot of people stops to using that. Thereafter, cocaine was started in 1884. So here, the cocaine was first used as a local anesthetic in surgery 1884. It was also used for the different kind of surgeries, including proctology also during those periods. Next. Next, the 20th century, introduction of spinal and regional anesthesia was developed. It was a very crucial time for in field of the spinal anesthesia development and regional anesthesia development for the long time in all general surgical treatments that it happens. First, it was the early experimentation. Dr. Weil Leonard Corning has experimented with spinal injections in 1885, and Dr. Beer, he works in 1898 and recognized as the first international use of spinal anesthesia for pile surgery. He has during those periods also, he in 1898, the knee surgery, ankle surgery, uh, it was spinal anesthesia were used. Beer used that Dr. Beer used uh, cocaine in local anesthesia in its spinal injections. So cocaine uses widely for the nerve block for the local anesthesia, and it was practiced very widely. The analgesia effect was cocaine was fantastic. So especially it was uh, many surgeons started local anesthesia in anorectal surgeries. It is recorded the first recorded spinal anesthesia in surgery was recorded in 1898 by Dr. Carl August Beer. It was a very crucial period that the development, research, and the practices of spinal anesthesia in proctology also, especially hemorrhectomy. It's supposed to be very safer surgeries during those days with minimal pain and longer duration can be done. Next, late in 20th century, it get advanced. The main drug that we are widely using now, lignocaine and bupivacaine, were introduced for the local blocks. Lidocaine, that is also known as lignocaine, and bupivacaine are the local anesthetic used in hemorrhoidal surgeries to numb the area, reducing the pain both during and after surgery. Lidocaine, it was first introduced as a local anesthetic drug in 1949. Then second one, bupivacaine, it was discovered in 1947 as a long-acting local anesthetic. It provides extended pain relief after procedure, making it useful for managing post-operative pain in the hemorrhoidal surgery. Later on, lidocaine and bupivacaine are oftenly using in combinations for the pile surgery. Then along with that, they uses for the fistula and other proctological small cases also. But there is no any special documentation that who has used first lidocaine or bupivacaine as a local region. So after that, lidocaine and bupivacaine were used for the local blocks. The use of mild sedation like propofol, midas, and regional blocks were widely practicing in proctology. Nowadays, anorectal surgeries gain popularity because of their type of anesthesia. It also emphasizes the patient safety and recovery. Next. Now, in the 21st century, that the main anesthesia in proctology, which includes 4 types of anesthesia, that is local anesthesia with sedation. That may be different varieties, different types, and people can give in personal techniques and different techniques. Second is spinal anesthesia. Third is TIVA, that is the total intravenous anesthesia. And fourth one, septa block, that is specially developed by Dr. Ashok Ladda sir in 2018. SEPTA means simplified, easily reproducible pudendal nerve block technique for anorectal surgery. It specially Pudendal nerve provides sensation to the perianum and the targeted in this area only it is targeted. It's our goodness that we almost our all proctologists and all surgeons they had made to Dr. Ladda sir, and widely everyone is doing the septa block under proctology practices under septa block. Next. This is the simple technique which I am explaining here for the local infiltration, which we call as the diamond block. In the lithotomy position, 12 o'clock, 6 o'clock, then 3 o'clock and 9 o'clock. We just are blocking hemorrhoidal nerve, internal pudendal nerve, and anacoccygeal nerve to get blocked for the local infiltration. Simple combination. Generally, we use lidocaine, then bupivacaine, and distilled water. Next. This is one case under the local anesthesia. You can see a small video. We are giving here a local diamond shaped block. This is a 9 o'clock position, local block. It's a 3 o'clock position, local block. It's a very simplified. Patient is not under sedation. Just we had a sprayed. It's a grade 3 internal hemorrhoids, and we are doing our traditional Sharakarma procedure for three of hemorrhoids, that is a 3 o'clock, 7 o'clock, and 11 o'clock. You can run it, Harshal. You can see very widely it becomes Jambu Phalavarna Sadrusha. Each and every procedure we can do under under local anesthesia, but certain cases only we have to adapt and we have to give saddle only. Hemorrhoidectomy, next. This is the case of then fistulectomy, next. Ksharakharma, just we have seen video, next. Then Ksharasutra ligation for piles also we can do, next. Partial fistulectomy with Ksharasutra, next. We can do the sphincterectomy or fissurectomy with excision of sentinel tag. These are the simple cases we can use local block and we can do that. Next. Excision of anal polyp, next. Controlled Lord's anal dilatation, next. Sphincterectomy, next. All procedures we can do that. Many people has developed number of types of local anesthesia. They can perform complex fistula also, and even many people are doing laser, then stapler surgery also under pudendal block or septa block. This is the summary journey from herbal sedation to the precision of the precision anesthesia. SUSHRUTA laid a foundation for surgical and anesthesia science. Today's proctology thrives on safe, effective, and patient-focused anesthesia. Next. Next. So, before that, so take a message that one of the best technique for the daycare procedures in proctology, this method stands out of the one most effective technique for local anesthesia. While it is not only approach available, it is among several reliable and proven methods used in the clinical practices. It offers significant benefits to both patients, surgeon, ensure comfort, efficacy, and faster recovery. So we have seen the development of the anesthesia as from our father of surgeons, Sushrut, till our father of septa block, Dr. Ladda sir, in practices of the proctology. Next. Once again, I'm very thankful to my Guruji, Dr. Meena Sheikh, Dr. Sangvi sir, Dr. Solanki, Dr. Gore, and obviously my wife also. Next. Thank you, sir. If anyone is having question, Dinesh sir, you can ask or you can continue Rao sir's lecture.
So we can continue, sir. Rao sir is there.
Thank you, sir. Thank you once again.
Thank you. Thank you, sir.
I hope,
Hello.
hello. I hope
Hello,
this
sir.
time
Hello.
I will be able to. So make me host if you are doing.
Harshal. Harshal, make Rao sir as a host.
I'm trying actually, but I'm not getting that screen broadcast.
Okay.
Unless,
Pawan sir is host now.
yeah. You can make me co-host so that I can broadcast.
Hello, Pawan sir.
Is in my
Sir,
screen? Hello.
पवन सर दूसरे फोन से ज्वाइन हो गए।
अच्छा।
जो दूसरा फोन है ना, डॉक्टर एस दत्तात्रेय राव करके, उनको होस्ट
हाँ
कीजिए।
जी, आपका विजिबल है।
अभी विजिबल है सर?
हाँ,
यस यस
प्रेजेंटेशन
यस
विजिबल है।
यस
ओके ओके, थैंक यू।
यस
आप भी
यस
ऑडिबल है।
Audible है and visible है. Okay. I will start now.
वेलकम
यस यस, यू
वेलकम।
कैन स्टार्ट।
So actually, I'm sorry that some glitch was there last time. This is actually a presentation about the Sharasutra's mode of action. So, which the study we have carried out between 2000 to 2010, and I will place before you some of the glimpses of this whole study. So this is Lord Balaji and his consort Padmavati Devi and Dhanvantari, Lord Dhanvantari. SUSHRUTA, a special art was drawn by our one of the greatest artists. So he's approaching to the patient with his lancet and other. Professor Deshpande's picture. And now, so in introduction, I would like to say that the Sharasutra now everywhere it is a proven and well documented and surgical technique, particularly in the field of fistula nano, and everywhere that is now adopted, and even online shopping also you will get the Sharasutra and other material related to it. Sorry. So actually what happens with Sharasutra when it is applied, what will happen in that local tissue, that we have to see. And over this aspect, there is no much work is done so far, as I feel it. And few of the studies, they have studied the histological changes in the anorectal tissue. And few workers, they worked about the effect of antibacterial effect of the Sharasutra. And a few of them, they analyzed the even Japanese surgeons also, they took it and analyzed Sharasutra and found certain active principles in it, and which will be like curcumin and euphorin. Those were actually isolated, and that analytical work is also going on. but the actual changes at the biochemical level, that was not actually studied. And that was very few workers might have done wound healing studies and like that. So here a effort is made to study actually effect of the Charasutra on local tissues. So the question to know the action of Charasutra when applied in the fishless tract was on since the advent of Charasutra. So people would say that it is mere mechanical action or chemical cauterization or antibacterial activity or a novel technique like local drug delivery system. So all these were the various schools of thoughts and how the Sarasutra works. People say that it is only mechanical effect and sometimes it is antibacterial effect like that. So, but actually what happens after you put the Sarasutra in the tract, there will be local irritation and with naked eye also we can see there will be inflammatory changes and there will be some linear tissue necrosis will be there. And then the shading off of the necrosed tissue and bad granular tissue and fibrotic tissue will be there. And then the new tissue lays down, the collagen lays down, and then there will be complete healing. So in this process, what actually happens, what the chemical changes or biochemical changes takes place in the tissue that we wanted to actually know. So with that idea in mind, we carried out this study. So mechanical action, it is not acceptable. Chemical cauterization not fully understood. So that's why we have taken up this study. And antibacterial activity also. People say that they act like a very good antibacterial, but that was the era of that when antibiotics one after the other that is coming. But in spite of using that broad spectrum also, there is no chance of complete healing of the fishless tract. Then a suggestion like a local drug delivery has come, and that was somewhat acceptable. But what actually takes place in that local area, local tissue in the tract, that we wanted to actually establish. So in this present study, we plan to explore the probable mode of action. Hence, the study was actually segregated in three aspects. One is the study of the biochemical, that is actually that takes place or the biochemicals are released in the tissue, in the local tissue, in the tract area, and to study those tissues and those biochemical agents. So that was one part of the study. The second part was the histological studies, taking the bit biopsies and taking it to the pathologists and taking all the pictures and reading them. And third one is the cultural studies, the culture and sensitivity studies of the whatever the secretions are there in the fishless tract after the use of the Charasutra that was studied. So these three aspects the study has gone, and of course the materials and methods for the first type of study. There's the histochemical study, then histopathological study, and bacterial study. So for these, three separate groups are taken because we cannot subject the patient for all these three type of studies, but we took three separate groups and studied in each group one of the parameters only. And in the histochemical studies. So in the department of Shalia, we took the Smuhi latex, Arca latex, and Papaya latex. We used to make all the three types of Charasutras, and that were taken, and the histochemical parameters were actually studied. So what is the method here? We have to collect the tissue from the tract. Some 5 grams of tissue was required, and the zoology lab of our SV University and the SWIMS pathological lab, those people, they have collaborated a lot, and we used to take this tissue and take it into the particular media and take to them immediately on 3 occasions. That is one on the third day, and then on the 15th day, and then on the 21st day when we were changing the thread. So the very small bit of biopsy is taken, and that was the 5 grams was for them it was enough, and they have studied these parameters. The parameters are total proteins of the tissue, the total carbohydrates of the tissue, estimation of alanine aminotransferase, that is ALT. It is an enzyme. Actually, we take these studies for knowing the liver functions, but in tissues also, these will be actually transferring, and that is also we can understand how they were, their status was. And then estimation of exosmin and estimation of the hydroxyprotein. Actually, exosmin and hydroxyproteins are the markers of proper healing of the tissue. So they follow some definite way. Even Dr. Udupa and others who worked on the wound healing and BHU and other, they also take these 2 parameters as the markers, and they have shown the results in these 2 parameters only. So those 2 parameters were also taken. So totally 6 parameters or 6 type of estimations we took, and this was done not only by me, but I was only instrumental to take the biopsy and to give them whatever. So it was done by a famous zoologist who was also become a vice chancellor later, and those were actually done with full of their support and other also. So these were the hydroxyprotein and hexosmin, method of Stageman and method of Elson and Morgan that were adopted, and ALT, AST, some other method is taken, and total proteins, Anthron method, that is the standard method for proteins, knowing proteins in the tissue, and the carbohydrates was Lowry method that was adopted. And if you see the results, there were 3 samples, as I told you, the 3 samples, first sample, second sample. First sample was immediately, not immediately, but after 2 or the third day of the application of the Ksharosutra, and second was on 15th day, and third was on 21st day. We took the bit biopsies and subjected them for the study of the carbohydrates, total carbohydrates. So you can see that the first sample, there was 3.39. So it has increased to 4.0. We can see in this table also. The first biopsy, it was 3.4 and it has came to 4. So likewise, the carbohydrates were actually increasing. That means the local availability of the carbohydrates, which are the actually required for the tissue proliferation and tissue laying down. So that was increasing. So total number of patients were 12, and then we took them the same biopsy, the same piece from that. They have also estimated proteins, total proteins. So in total proteins also, you can see that the average was 4.08 to, it has raised to 4.46. So in 21 days, the turnover of the protein availability in the tissue was increased. And you can see the bar diagram here. The values have increased from first biopsy to second biopsy to third biopsy. It was maximum. In 21 days, it was maximum. And the protein availability or bioavailability of the proteins was very much important. And that was actually seen increasing after the use of the Ksharosutra. And if you see AAT and ALT, those 2 things also, if you leave the numbers and you can come to this diagram. So ALT was, initially it was going down, but in the third biopsy, again, it has gained and it has increased. And likewise, the AAT, aspartate amino transferase, that was continuously increasing. This shows that it is also the enzymes which are responsible for the protein synthesis and collagen synthesis. So for that, these two enzymes are important, and they were slowly increasing as the days were passing. That means the local availability, not only availability of the protein, but the synthesis to form them in the collagen was also continuous. Then the special markers of the healing that we have seen, that is exosmin and the hydroxyproline. So you can see in this graph, there is a U type of curve you can find here. So the hydroxyproline, what happens in good healing conditions, hydroxyproline tries to increase. It increases in the tissue. That is the tissue levels. All these are the tissue levels, not the whole serum levels. And the hydroxyproline increases day by day, and it reaches the highest mark, whereas the hexosmin, it increases in the beginning, it will be very high, but it slowly decreases and decreases. So this type of U type of curve will be forming by both of them. So this is a important curve, and it was also reported in other studies. As I told you, the Udupa and et al., their study also. The same curve also you are passing here. So if this curve is formed like this, you can see that there is a proper healing. So overall, what we can understand is the biochemical parameters were very much in favor of good healing, good protein turnover, and good actually availability of carbohydrates, which are the energy source for the local tissue. So not only the quartering and only the shading off of the tissues are going on there, are taking place there, but even good type of what you call environment is formed, and in which the track tends to heal as fast as possible. So then we have turned to the second leg of the study, that is a histological study. For again histological study, we took some other patient, because the same person again and again biopsy we cannot take. For histological studies also, the same, we have to take the biopsy. It's a very small bit biopsy, and which is taken again same third day and second week, that is 15th day, and last when the thread is fallen off. So we have to see in the last how the histological changes are taking place. That is the slides they will be making. So bit biopsy, slide preparation, 3 to 4 micron thick sections, microphotography, and permanent microscopic slides that were actually taken place. And there was the study was actually for the stages of healing. That is, epithelialization stage is there or not, new capillary formation is there or not, fibroblastic proliferation is there or not, and lastly, collagen and scar formation is seen or not. That we have studied. So you can see the biopsy. This is for first biopsy view. You can see the first layer. Much of the epithelialization is there. The small tissues, they are actually epithelialization we can see in overall this picture. And this is also epithelialization. Here you can see. So, and in second week, to our this thing, we were the pathologists also viewed this, and they were very much impressed by this, that there is formation of the capillary. Here you can see in the middle some round shape of this thing, that is nothing but the formation of the capillary. So in the new laid down tissue, the capillaries were also forming. That means the whole healing was complete, with the supply of blood was also establishing. You can see here, this is the capillary formation. So very very good sign of good healing that that was. This is also capillary, you can see in the picture. And second week. And when the third week is there, you can see that collagen is forming in the edge. here the capillary is on this side and the other tissue is there, but the collagen was laid down. That means the complete scar formation or the linear scar formation in the tissue was evident by that. So this you can see here also, the collagen is forming. So likewise, if the histological studies, if you see, that means the tissue is supplied with very good building material, that is the proteins, and there is a very good environment. And due to that, if healing is very fast, even capillaries were forming on 15th day itself, and there was complete healing because of the formation of the collagen. But still our doubt was not clear. So we thought some bacteria also maybe the reason for the formation of all this pus and debris and all those things. So we carried out in another 12 patients the bacteriological studies. In bacteriological studies, actually what we have to do is we have to take the culture in sterile and in movable media, and we have actually sent them to the particular departments like the veterinary bio microbial department and other microbial department in Streams Hospital. So both were sent separate cultures and samples, and that was cultured, and the standard techniques were used, and that was cultured. And we, to our actually wonder, or we were shocked to see that this is important table. You can see that the 8 patients, in 8 patients, they isolate the first culture that is taken on the first day. So second culture on 15th day, and third culture on 21st day or later. So you can see that this was the culture studies were done in 8 patients only. And you can see that in all of the patients, the culture was positive for one or the other microbial organism. Like you can see in the first one that E. coli was continuously there. It was not completely gone, but Streptococcus and other species were actually controlled. In second, you can see all the 3 things are continuous there, and in 1/4 you can see Klebsiella was continuously there in all the 3 cultures. That means throughout the Charasutra treatment. And for your information, the patients were kept on minimal antibiotic also. Minimal antibiotic, that is some ampicillin, fluoxacillin type of drugs, because of should not form excessive blood. And of course, our treatment like Kanchana Gugulu and Arogyavardhanivati and Saptamishati Gugulu were also given. But still, in spite of all these things, that the bacteria, presence of bacteria was continuous. Though it may not be very, that means high in count, but it was continuous. That means that doesn't become totally sterile. But the results of all the patients were positive. That means the fistula completely healed, and all other the benefits of the Charasutra, that everything that was benefited to the patient. So we can conclude that the Charasutra affect the tissue to enhance the protein turnover. It follows the wound healing norms. That means the hydroxyproline and hexosmin levels will be matching with the normal wound healing. Early epithelialization and fibroblastic activity we have seen in the slides. New capillary formation at an early stage we have seen. And actually, marked antibacterial activity is not actually seen. So there is some bacteria were susceptible, but most of the bacteria were continued. Though their colonies might have come down, and they have not hindered the healing also. So that's how we can say that it is not just cauterization, or not just antibacterial activity, or not just mechanical form tie up to the Charasutra, but it is definitely a different thing in which I think many factors are working, and those are the important things and important landmarks for the good healing and non-recurrent. That is also important, because when the fibroblastic activity forms and thick layer of fibrosis, a linear fibrosis will be forming. There will be no chance of further formation of the tract in the same area. So that is an important aspect of the Sharasutra therapy. So my acknowledgement with all the proctologists, and I just really indebted, because I was guided by Professor S.I. Nagaralji. Because I submitted this my work for the PhD to Pune University, for where Dr. Nagaralji was my guide. And he only suggested, why you do general, all the Sharasutra, these many cases, that UCT, PRD, all those things. You do something new one. So he suggested you go for a histological and histochemical estimation. Then that has sparked me, and generally. So I'm really thankful to all my professors who also given me a very good chance. And sincere thanks to Dr. Mahesh Sanghvi and all the our members here and all the doctors. But this is not the complete thing. It is, I think it's a beginning. In this direction, actually, new research is to be established and much more wider research to be done. Then only we can come to a conclusion. And probably that may give us a chance to extend this type of techniques in other problems also, in other like cancer or some other things. And there we can establish very good treatments based on this type of research. I'm really very much thankful to you and all. Thank you. So, Sushruta's, this I always chant, Ekam Shastram Madhyano na Vidyat Shastram Nishcham, Tasmat Bahut Shruta Shastram Vijaniyat Sikisa. Thank you, one and all.
Thank you, sir.
Thank you.
Dr. Pankaj, sir. Hello. Dr. Pankaj, sir.
Okay, I think he's lost the link.
I think.
But was the slideshow clear throughout?
Yes, sir.
Okay,
It's clear.
Okay.
Hello, Pawan, sir. Hello, Pawan, sir. Today, Dr. Rao, sir, reveals some secrets of action of Sharasutra. No doubt the process of research is always continuous. It never stops. But this tremendous work of Rao, sir, is remain as a milestone for upcoming researchers and all who have curiosity in Sharasutra at national as well as globally. Thank you, sir.
Thank you. Okay, may I leave now?
Yes, sir, you can leave.
Is there
Thank you,
any
sir.
other speaker going to speak now?
No.
No. Thank you.
Hello, sir. Can I ask one question, sir?
Yeah, sure. But I'm not only hearing you, I'm not seeing you.
Okay, sir. Myself, sir, Dr. Alok Gupta.
Okay.
Sir, have you used Sharasutra in, sir, any COX patient, sir?
COX patient also we used, but there I found that the cutting is very fast.
Okay.
And within 3 weeks or 4 weeks, bigger tracks are also laid open, but healing will be very much delayed.
Yes, sir.
Automatically we have to go for anti-ATT, anti-tubercular treatment. But why we have used, sometimes we cannot screen the patient completely. Sometimes one of my first experience was he was not screened completely, and we just taken him as a routine and used the Charsutra. But in him, the cutting was so fast, within some 5 to 6 centimeters intersphincter fistula has cut off actually through the tissues within third or fourth week only. So we were wondering why this is like that, and there was a very little chance of healing also. So then we took his whole screening, like two knot test and blood for this tuberculosis. Then we found that it was positive, and he was sent to a other physician who take care about his tuberculosis, and then this open wound was also healing very well. After 6 months or sometime, the complete healing was there. So that was my experience regarding this.
Okay, sir. Thank you,
But
sir. Why I am
after that, we are whenever there is a chronic type of a long-standing fistula, we are as a rule we are screening them for the tuberculosis also.
yes, sir, because I am having two patients at present, sir.
Uh,
Everybody is refusing them. They have patient has taken already full term course of AKT, sir.
uh-huh.
But fistula is there, and nobody is taking accepting that patient. So I am planning to do a Kshar Sutra treatment in that patient, sir.
So
Because suppose we done fistulectomy,
if you can make a mild type of Sharasutra, that means not very
slow
thick,
cutting, sir.
slow cutting. So that
Yes,
will,
sir.
I think, help him definitely. But you also have to rule out viral antibodies, HIV and other things also, because there will be coincidence of tuberculosis with HIV and other type of infections.
Yeah, all investigation are done, sir.
Okay,
But
okay.
nobody want to accept that patient. So I am asking,
No, nothing, sir.
suppose we do,
Let him
sir,
take good anti-tuberculosis treatment as well as you continue our medicines and Charsutra. It will be done.
okay, sir. Thank you, sir. Thank you for enlightening us. Thank you very much, sir.
Welcome, welcome, sir.
Thank you, all of you. Tomorrow we have three more legends in Ayurved surgery. First one is Dr. M.B. Rao. He's from Tirupati. Then Dr. Alok Gupta, sir, who is from Yavatmal, and Dr. Sachin Patil, sir, who is from Holy City, Nasik. So please join tomorrow also. With this, I can conclude this session. Thank you, all of you. Thank you.
Thank you.
Hello, sir. Hello, sir. संघवी सर इज
हाँ
देयर?
बोल। हाँ बोल।
हाँ सर, आप कुछ कहना चाहेंगे?
नहीं नहीं नहीं, क्लोज करो, बहुत टाइम हो गया है, सो जाओ।
ओके सर, ओके, थैंक यू।
थैंक यू फॉर एवरीथिंग। थैंक यू दिनेश। गुड नाइट।
ओके, गुड नाइट।
कारण क्षमा चाहता हूँ। थैंक यू, थैंक यू, थैंक यू वेरी मच। बहुत बहुत आभार आपका, बहुत बहुत आभार। गुड नाइट टू ऑल।